I'm going to explain why planning your pregnancy is so important for your sexual health, starting with why it is important for younger women. Having a baby before the age of 17 can put the mother at much greater risk of complications in pregnancy and childbirth. They may even go on to lose the baby or die during childbirth. Women's bodies need time to recover between pregnancies, and also women who have more than 4 children are more likely to experience bleeding and other problems in childbirth and even death. Using contraception can help prevent against these problems. Sometimes people worry that knowing more about contraception might encourage people to have more sex and to have sex earlier, but we know that this helps people to make safer and more careful choices. Attending sexual health classes in your area means a trained health worker can help you to understand the different contraceptive options available to you and answer your questions.
Let's learn about the cycle of reproduction. Acquiring a sound knowledge about the reproductive systems of both male and female will give you a good understanding on family planning. The male reproductive system consists of penis, testis, vas deferens, seminal vesicle, prostate gland. The penis and 2 testes are located outside the pelvic cavity, while the vas deferens, seminal vesicles and prostate gland are placed inside the pelvic cavity or pelvis. Sperms are produced in the testes. These sperms travel through the vas deferens and get stored in the seminal vesicles. During ejaculation, sperms and secretions from the seminal vesicles and prostate gland come out of the urethra as seminal fluid. This is known as sperm fluid. Approximately 300 million sperms come out during ejaculation. Next, the female reproductive system is shown. Ovary, fallopian tube, endometrium, uterus, uterine cervix, and vagina are parts of the female reproductive system. The parts of the female reproductive system, namely ovaries, fallopian tube, uterus and cervix, are placed inside the cavity. The size of the uterus is usually that of a clenched fist. During pregnancy, the uterus enlarges with the growth of the fetus. An ovary is usually the size of an olive. The two ovaries produce ova and female reproductive hormones, estrogen and progesterone. Usually, one of the two ovaries releases an ovum once a month. This is called ovulation. Ovulation usually occurs about 14 days prior to the onset of subsequent menstruation. Ovum stays inside the fallopian tubes for approximately 24 hours. After that, the ovum travels through the fallopian tube towards the uterus. If the ovum is not fertilized, the inner lining of the uterus or endometrium gets separated and menstruation occurs. This process is called menstruation. During this period, there could be some pain in the lower abdominal area. Flow of menstrual blood and birth of a child all occur through the vaginal canal. It is important to understand hormonal activity. This process occurs from menarche to menopause. Menstrual cycle is controlled by two hormones produced by the pituitary gland. The female reproductive hormones, estrogen and progesterone, are secreted by the ovaries under the influence of the pituitary hormones. During the first half of the menstrual cycle, the inner lining of the uterus grows under the influence of the estrogen hormone. During the second half of the menstrual cycle, blood supply and secretions of the inner lining of the uterus increase, mainly under the influence of the progesterone hormone. If the ovum does not get fertilized, the inner lining of the uterus gets separated and menstruation occurs. If the ovum gets fertilized, it gets implanted in the uterine wall and grows as the fetus. The union of sperm and ovum usually occurs in the distal half of the fallopian tube and is called fertilization. The fertilized ovum is called zygote. It travels along the fallopian tube whilst undergoing divisions towards the uterine cavity. The developed zygote comes to the uterine cavity and gets embedded in the uterine wall. This is called conception. Development of the fetus. The fertilized ovum or developed zygote, which is implanted in the uterine wall, develops as the fetus during 6 weeks. During 8 and 10 weeks, the developing fetus is nourished by the placenta. During 12 to 14 weeks, the fetus grows approximately 11 centimeters and most of the organs are developed. By the 24th week, the fetus is about 30 centimeters in length. By this time, all the organs are differentiated and formed. Stages of labor. The growth and development of the fetus is around 40 weeks. In a normal delivery, the fully developed fetus is delivered head first through the vaginal canal. There are 3 stages of labor. Firstly, the uterine cervix gradually dilates up to 10 centimeters in diameter. Second, the baby is delivered through the vagina. And thirdly, the placenta is delivered. Using a contraceptive method helps you to prevent an unplanned pregnancy. There are many contraceptive methods. They are divided into 3 main categories as modern, natural and traditional methods. Modern methods are divided into 2 categories as temporary and permanent. Temporary methods could be divided as hormone and non-hormone. Examples for hormone method are oral contraceptive pills, injectables and implants. Hormone methods could be used up to 50 years. Intrauterine device or the loop and condom are non-hormone methods. Under modern methods, the permanent contraceptive methods are female and male sterilization. Natural contraceptive method was introduced as the second method for family planning. Under the natural method, there are standard day method, basal body temperature method, cervical mucus method, symptothermal method and lactational amenorrhea method. Abstinence and discharging sperms outside the vagina, withdrawal, could be cited as traditional family planning methods.